So I'm going to call Mary up here, Mary Q from the University of Chicago, a glaucoma specialist. She's doing a great job at that program down here in Chicago. And she's going to talk about really how we can use laser and surgical options to help you control the glaucoma and maintain quality of life. Thank you, Mary.
Morning, everyone. Thank you so much for
Take my cell phone so it's not in your way.
coming to this session, and thanks for inviting me to talk to you all about glaucoma, lasers, and surgeries. I'm from San Francisco. I was aware of the Glaucoma Research Foundation when I was there for medical school, so it's really exciting that I get to be here as part of a Glaucoma Research Foundation event now that I'm a glaucoma specialist. I'm going to focus my talk on lasers, in-office lasers, operating room lasers, and then surgeries, both the bigger traditional glaucoma surgeries and the newer micro-invasive, less invasive glaucoma surgeries. So first I'm going to start with the in-office lasers. The first one of these options is called selective laser trabeculoplasty. And what is it and how does it work? SLT is a laser procedure that's done in the office, and it works on those pores of the eye that Dr. Singh talked about, where the fluid exits your eye. The laser energy goes to that tissue that normally drains the eye and just kind of stimulates it to drain a little bit better. It's kind of like pouring Drano down a sink that's clogged. It doesn't really do anything to the pipes of the sink. It just helps it drain a little bit better. And who qualifies for this? Well, patients with a lot of different types of open-angle glaucoma who might need to lower pressure or who might need to get off some of these drops with all these side effects might benefit from SLT laser. You may not qualify for this if you have angle closure glaucoma and your drain is plugged up by your iris tissue, like Dr. Hawkins talked about, or has permanent scar tissue stuck in that drain. Then the laser can't even get to the right place to treat that tissue. And what are the benefits and risks of this type of laser? Well, the benefits are that it'll lower your eye pressure by about 20%, and it works in most people, like 80% of people, and there's no cuts on your eye, there's no bleeding, it just takes a few minutes, it's done in the office, you go home and you can just go about your normal activities. There's not a very involved recovery process at all. It's certainly worth a try. However, the laser effect can wear off after weeks, months, or years, and it's a little bit unpredictable how long the laser might last for you. The good news is the laser can be repeated, so we can always try it again. There's not too many side effects of the laser itself. We keep you around in the office for about 15 minutes to check your pressure, make sure it didn't go up too high right after the laser before you go home. If the pressure went up a little bit, we might give you one of those pills to help lower the pressure before we let you leave. There's also a chance that you might get a little bit of inflammation in your eye after the laser, so your eye might be a little red, a little light sensitive, and if that happens, we give you an anti-inflammatory eye drop. But pretty much those risks are minimal compared to the benefit of the laser, which is that it might lower your pressure by a little bit and get you maybe off of a drop. So what should you expect if you're coming to have SLT laser? It's done in a laser room that's usually in the same place that you go see your eye doctor. Sometimes it's in the same building as the surgery center. And it's just a clinic office room. You just wear your normal street clothes. You don't have to get into a gown or have any sedation through your IV or anything like that. We give you some eye drops that numbs your eyes so you'll be comfortable during the procedure. And we usually give you an eye drop that helps lower the pressure a little bit to help prevent your pressure from spiking up. And then you get a contact lens put on your eye, the same as the type of lens that Dr. Hawkins says that we use to examine your drain. It's the exact same lens that you're probably used to from your office visits. And there's some cold gel that helps the lens stick to your eye. And then you just hear about 100 clicks and you'll see a flashing light, and that's the laser energy going to your natural drain tissue to help those pores just drain a little bit better. It doesn't really hurt when you have it done, and then your eye might feel a little sticky, a little bit irritated, a little sore. You sit there for a few minutes, we check your pressure, and then we let you leave. You can just go back home, go to normal activities. So what drops will you have to use after the laser? Some doctors will prescribe an anti-inflammatory eye drop to use for a few days. It's not necessary in everybody. Your doctor will let you know after the laser if you're supposed to continue all of your glaucoma eye drops or if you're supposed to stop one of your glaucoma eye drops. Long term, of course, we'll have to see if the laser worked, how well did it work, is your visual field testing stable or not, before we can know what drops you need to be on long term. And how soon after the laser do you have to come back? I usually see people 6 weeks after the laser, but if the pressure's a little bit high right afterwards when I check, then sometimes I'll see you back in a week. Will SLT cure my glaucoma? I put this question on every slide, but after a few slides I'm going to stop answering it because the answer is always no. The laser's not going to cure your glaucoma. You're still going to have to come to the eye doctor pretty often to get monitored. You're still going to have to come and check if your pressure's creeping up. You're still going to have to come and check if the visual field is getting worse. The goal of the laser is just that it might help lower the pressure or help you get off some drops and keep your pressure the same. It doesn't bring back any vision you've lost, unfortunately. It doesn't do anything to improve your vision. But it's an option for a lot of people with different types of open-angle glaucoma, and it's certainly worth a try. I offer it to practically everybody who's a candidate. The next topic of in-office lasers is laser peripheral iridotomy, and Dr. Hawkins touched on this briefly. This is a laser that is specifically it's performed in the office to prevent or treat angle closure glaucoma. And what exactly is angle closure glaucoma? Dr. Hawkins already explained it a bit, but the drain of the eye is in this angle. It's between the colored part of your eye and the clear part of your eye in the front of your eye. And angle closure can happen if the colored part of your eye kind of squishes up against the trabecular meshwork drain tissue, and then the fluid can't get out. And then this causes the fluid to build up behind the iris, and that just makes the iris squish up against the drain even worse, and then you end up in a vicious cycle where the drain is more and more closed and the fluid can't get out, and the pressure goes up and up and up, sometimes very quickly, and this leads to high pressure and damage to your optic nerve. So how does this laser work? The laser puts a little hole in the colored part of your eye, so the fluid that's trapped behind the colored part of your eye can get in front of the colored part of your eye and exit out of the natural drain. This way the fluid's not building up behind, and the iris is not getting squished up against the drain, and then the fluid can exit out your eye the normal way. So who qualifies for this type of laser? In the past, many people who are kind of at risk of having angle closure, who have crowded or narrow angles when we look at you in the office with that lens, a lot of patients like that would get the laser to prevent their narrow angles from becoming so narrow that it causes a problem, so narrow that it causes high pressure, so narrow over time that it causes scar tissue to form between the colored part of your eye and the drain. So narrow that you might end up with high pressure and optic nerve damage. But lately there's been some data that says that maybe these patients who just have narrow angles but who don't really have any problem yet, who live close to an eye hospital and who can get regular checkups, maybe they don't necessarily need this preventative laser per se, because progressing from that very mild version of angle closure suspect to actually getting angle closure or angle closure glaucoma can be pretty rare. So I don't necessarily recommend the laser for every single person who has kind of suspiciously narrow angles, as long as you can come to the eye doctor pretty frequently and get monitored. But some people, they live in a really rural area, they may be traveling a lot, they may not have access to get to an eye doctor really quickly. And in patients like that, if you're at risk of having this problem, then I would recommend having this preventative laser to try to reduce the risk of having a big problem. And then, of course, Dr. Hawkins touched on the acute angle closure attack or crisis, and that's when your pressure shoots up all of a sudden. Patients like that definitely may need this laser to break the attack. And patients like that often will have to have cataract surgery soon, too, depending on how things go. So what are the benefits and risks? Well, the benefits are that it might prevent you from going from just a suspect to actually having angle closure or angle closure glaucoma. And the benefit is that if you have an angle closure attack, it might help you get out of that. It's very quick, it's done in the office, there's no cuts on the outside of your eye, though it does cut a little hole in the colored part of your eye. You go home that day, there's no special precautions you have to take, there's no infection risk. It might be able to prevent you from having a more invasive glaucoma surgery in the future. And it's generally very safe, but there are definitely some risks. In some patients, especially people like me who have brown eyes, their iris tissue might be really thick, and it might take a lot of shots of the laser to get through. And sometimes you have to come back more than once to make sure that that laser really did make an open hole in the colored part of your eye. And sometimes that can cause a bit of pain and inflammation, so you might need some anti-inflammatory drops to keep your eye comfortable and to prevent the hole from closing up. And sometimes the hole can close back up, so we have to open it back up again. And sometimes that laser hole can cause a little bit of bleeding in your iris, but that usually goes away on its own. And it's possible for your eye pressure to shoot up a little bit after the laser, and we usually do keep you around for a few minutes to check and make sure it doesn't spike up before we send you home. So what can you expect if you're having this laser done? Usually people who are having this laser done are not in this acute angle closure crisis. So usually you're just in the office, your eye is feeling comfortable and normal, and you again go into a laser room, again you get numbing eye drops, and again you get pressure drops to help prevent a pressure spike. And you may also get a drop of pilocarpine, that special drop that causes you to have a headache, because that makes your pupil really small and makes the colored part of your eye stretched out really thin, so it's easier for the laser to get through. And then again, it's a contact lens that goes on your eye. And instead of hearing 100 little clicks, it's just a few shots. So like boom, boom, and it kind of stings like a rubber band is getting snapped against your wrist. And then it's over. It just takes a couple minutes. It's shorter than getting SLT laser. And you might see a flash of light. And then once the hole is open, that's it. Then you go and wait in the waiting area for a few minutes. We make sure your pressure's not spiking, and then we let you go home. We might give you a few anti-inflammatory eye drops to take, and we might give you a few anti-inflammatory eye drops to take. We might tell you whether or not you have to continue glaucoma eye drops or whether you can stop some of the ones you're on, and then we'll have to monitor you over time to see how it goes. How soon after the laser do you have to come back? Usually about a week or two. We like to check and make sure the hole is open, you're not having too much inflammation, and that your pressure's okay. You know, the question to this next one, will LPI cure my glaucoma? This is sort of a special circumstance, because sometimes if your laser does make it so your drain is now open and now your pressure is normal and now you're not on any eye drops, it's kind of like it cured your glaucoma. However, as you get older, your cataract in your eye gets thicker and thicker, and then the drain gets crowdeder and crowdeder, and then you could still have the problem in the future where your pressure goes back up. So anybody who kind of has glaucoma or at a risk of glaucoma, you're never really cured, and you should never think of yourself as, oh, I'm cured, I never have to go back to my eye doctor, because that's never true. Okay, so now we're going to move on to some lasers that take place in the operating room. These lasers pretty much all work by making the eye make less liquid. The first one of these lasers I'll talk about is called Cyclophotocoagulation. What is it and how does it work? So this type of laser is non-invasive. It's a laser probe that goes on the outside of your eye, and it goes to the ciliary body, which is the part of your eye that makes liquid, and it treats that part of your eye so that it makes less liquid. Like Dr. Singh mentioned, your eye has this gland, it secretes liquid, and a lot of the eye drops also treat that part of your eye to make it make less liquid. And this would be a sort of laser method to treat the exact same part of your eye, the same way that the eye drops work. This laser kind of works in a similar way. If there's less fluid getting made in your eye, then it won't build up, it won't get trapped in your eye, and the eye pressure won't be so high. It has to be done in the operating room because it kind of hurts, and so we can't just do it to you while you're wide awake in the office without some pain medication or sedation. Either we put numbing medicine in your eye socket while you're under light sedation, or sometimes we put you more deeply asleep so that you can get the laser done and stay comfortable. And who qualifies for this type of laser? Well, technically, any eyeball that has a pressure that's too high, we could go up to that eye and put the laser probe on the eye and perform the laser. But usually, we recommend it for eyes that don't see as well. So eyes that already have very severe damage or have very low vision or have other eye problems that have given them lower vision in this eye. Because one of the side effects of the laser is that sometimes it can make the vision a little blurrier. And so if your vision's already kind of blurry, then the risk of it is not so much. But if it's your only eye and you see very well out of this eye, well then maybe that eye would not be a good candidate to have this particular laser. Other people who might qualify for this laser are people who really don't want to have any kind of surgery that involves making a cut on the eye. Maybe that's just a little bit too much. You don't want the infection risk. Maybe it's somebody very elderly who lives in a nursing home, and we just want a quick procedure that helps a little bit to lower the pressure. In that case, something like this might be a good option. So the benefits, like I mentioned, it only takes a few minutes. It's about 5 minutes. I do about 16 to 24 spots of this laser, and each spot lasts 4 seconds. So it's really just a couple minutes. It's so fast. And it's not invasive at all. There's no cuts on your eye. And therefore, there's not really any risk of infection or bleeding. There's no downtime afterward. You don't have to do anything special with your eye. You don't have to do any, you don't have to avoid any specific activities. You can just go back to regular activities the next day. And the laser pretty much always works. It will lower your pressure a little bit. I mean, how can it not work? It goes to the part of your eye that makes liquid and it turns it down a little bit. But it can be a little bit unpredictable how much it's going to lower your pressure and how long those effects will last. And so it's a little bit of a guessing game. You know, is this going to last years, or are we going to be back talking to each other again in a few months because the pressure's gone up again? And there is some risk associated with this laser. There's some risks associated with the actual numbing medicine that goes in your eye socket. Theoretically, that could cause a bleeding problem, for example. And the laser itself can also cause too much inflammation. I mean, it actually works by causing a little bit of inflammation, but if you overshoot with the laser, there can be so much inflammation that the eye is kind of sore and painful. Or maybe the eye pressure goes too low, and then there can be some complications relating to your eye pressure being too low. And so that's why we generally only offer this laser in eyes that don't see too well to begin with. And what should I expect during and after my laser? Well, during the laser, you're going to check into the operating room like you would for any kind of procedure in the operating room, and you would get put into a gown, you would get an IV put in your arm, there would be an anesthesiologist that would talk to you about the sedation that they're planning to use for you, and then you'll get wheeled into the operating room, and then you might get put to sleep with some medication for just a few minutes while the numbing medication gets put into your eye socket, and then you'll probably wake up from the sedation and hear us talking, but the laser itself won't feel like anything. Your whole eye socket will be numb. And then you'll hear a bunch of beeping sounds for a few minutes, but your eye won't feel anything. And then we usually put a patch on your eye to go home just that day, because when your eye is numb, you might accidentally scratch your own eye, so we just keep it covered for one day. But the numbing medication wears off the next morning, and then everything's sort of back to normal in terms of activities. And some people don't get the numbing medication in their eye socket for various reasons, and in those cases, we might put you very deeply asleep, and then you wake up and it's over, and then your eye might be a little extra sore because it didn't get so much numbing medication, but again, you'll just go home. And since this procedure is done in the operating room, if you get the IV sedation, then you can't drive yourself home. You can't take the bus home. An adult has to drive you home because you've received sedation. And so that's a little bit different than those in-office lasers where you can sort of drive yourself home afterwards, even though your eye might be a little blurry. And what drops will I have to use after this laser procedure? Well, the post-operative recovery drops are an anti-inflammatory eye drop to reduce some of the inflammation that the laser causes, and a drop that dilates your eye and keeps it from having these spasms that can be kind of painful, so it just helps with the pain. And then your doctor will let you know whether you're going to continue your normal eye drops or stop some of them. And then long term, we just have to monitor you to see whether the pressure creeps back up again or if it stays low for a long time. One of the good things about this laser is that, unlike the other surgeries on your eye, we don't have to see you the next day. I like to see patients about 1 week after this laser. So it's just a very quick thing. You can just kind of go back to work the next day, or you don't have to come back to the eye doctor so frequently afterwards. The follow-up schedule is much easier than some of the bigger surgeries. And will this laser cure my glaucoma? No, the goal is just to lower the pressure, and sometimes it might even make your vision a little tiny bit worse. So again, it's just meant to keep the pressure down long term so you don't lose all of the vision from glaucoma. This micropulse laser is a more gentle version of that first laser, where instead of having 20 different beeps, it's just a continuous on-off pulse, and it treats the same part of your eye by making the eye make less liquid, but it's just less aggressive, and so we can do this version of the laser on eyes that see better. It's still usually done in the operating room. It still kind of hurts, so the process is about the same. The difference is just who's a candidate for it. And then there's a version of this laser that goes inside your eye called endoscopic CPC, where a probe goes in your eye through a tiny incision the size of a cataract surgery incision and directly treats that part of the eye to make the eye make less liquid. This one can be done at the same time as cataract surgery or if you've already had previous cataract surgery. This one has a few extra risks related to infection because there is a cut on your eye, but we give you antibiotic eye drops and the risk of infection is very low. So next I'll move on to the bigger glaucoma surgeries. The traditional glaucoma surgeries are trabeculectomy and glaucoma tube implants. A trabeculectomy makes a trapdoor on the side of your eye using your body's own tissues. The fluid inside your eye can go out that trapdoor and then collect in a space underneath the skin of your eye called the conjunctiva, and that basically just gives it a little more space for the fluid to go because your own drain is not working well enough. There are some stitches that hold the trapdoor closed, and sometimes the stitches can be cut to let the trapdoor open up a little bit more. Your body is trying to heal this, though, because you've just had surgery, so we have to put anti-scarring medication around the area of surgery so that it doesn't scar so much that the trapdoor closes. Sometimes it does close up, and then we have to do a procedure to open the door back up so that it can start to flow again. Who qualifies for trabeculectomy? Well, somebody who has a very high pressure and it needs to come down right away, somebody who has very severe disease, somebody who has a very low goal pressure, where a pressure of like 18 or 15 might still be too high for you and you need a pressure of like 10 or 8. These people might be good candidates for trabeculectomy. And what are the benefits and risks? Well, basically, the benefits are that a trabeculectomy works very well to lower your pressure a lot. It might be able to get you off all your drops. So it's very effective, and we've been doing this for decades, so we know a lot about it. Sorry, I just want to go back. But the risks are also much higher because this is a more invasive surgery. You have a risk of infection, even for the rest of your life, because that anti-scarring medication makes the skin of your eye kind of thin, and so for the rest of your life, you are prone to develop an infection around this part of your eye. You have to be very careful, and if you were to notice some suspicious symptoms, you'd have to get checked right away by your eye doctor because you could have a very serious eye infection. And there are some risks of bleeding during the surgery and after the surgery. If your pressure goes too low, there can be a very serious bleed inside your eye. This surgery is so effective that it lowers your eye pressure a lot, and when the eye pressure gets too low, sometimes your eye is a water balloon, and if you were to let the water or air out of a balloon, the wall of the eye can become kind of wrinkled or a little bit shriveled, and if that happens to your eye, then the vision can get blurry because the part of your eye that sees, the retina, gets wrinkles in it, and so then the vision's worse than it was, and that's not what we want. So there are definitely some serious risks with trabeculectomy, but it does work very well. During the surgery, it's done in the operating room, but it just takes a little longer than those laser procedures. So you might expect it to take 30 or 60 minutes. But you'll be comfortable with an IV in your arm and sedation going through your arm, so you'll pretty much feel like you took a nap, and then you woke up, and then it's over. You go home with a patch covering your eye. After the surgery, you're going to have to use a lot of anti-inflammatory eye drops to prevent your eye's trapdoor from scarring up. And the anti-inflammatory eye drops will go on for weeks or months even to try to keep that trapdoor flowing. There's going to be an antibiotic to prevent an infection, and then maybe you'll get to stop all your glaucoma drops, but sometimes we have to add them back if the pressure were to creep up. After the surgery, you have a lot of visits. 1 day, 1 week, maybe 2 weeks, maybe 4 weeks, and then every few weeks after that until things stabilize. And then eventually, maybe you just go back to every 3 to 6 month follow-ups. But there are a lot of visits after trabeculectomy. It's one of the bigger surgeries that we do with a lot of follow-up. So if you can't do those visits, then you can't have this surgery. The recovery process is a little bit more involved than some of the other lasers I described. We tell you no bending, no lifting, no straining, don't get water in your eye, don't get anything dirty in your eye. You have to wear a shield when you sleep for a couple weeks. Your vision might be a little blurry right after the surgery. There are stitches on your eye, might be a little uncomfortable. So it's not as quick in terms of getting back to work or getting back to your normal activities. And there are some activities in the future that we say to just be careful about, such as swimming in a lake. I mean, that could really give your eye a risk of getting an infection, for example. And we also tell patients who wear contact lenses that a trabeculectomy might not be a good option because the contact lens might irritate the surgical part of your eye, and you might be at a risk of getting an infection. And again, it doesn't cure glaucoma, but it does a great job of lowering the pressure a lot, and so it can really stabilize the worsening of glaucoma for a lot of people. So the other big glaucoma surgery that we do is an aqueous shunt or a tube shunt. There are many different types of tube shunts. I'm just going to talk about the whole category. It's really similar to a trabeculectomy in that it lets the fluid from inside of your eye go out of your eye through a passageway into the space under the skin of your eye, the conjunctiva. But the difference between a tube and a trabeculectomy is that the tube actually has a plastic straw that plugs straight into your eye, and that straw will stay open. And then there's a plate at the back of the straw, and your body will grow a capsule of scar tissue around that plate, and that's where the fluid goes. The fluid collects in that space and then gets drained by the tissues inside of your eye socket. And once you're fully recovered from this tube, it's not like you see it or feel it or anything. It's just up in your eye socket and it stays there forever. Who qualifies for a tube? Well, anybody who needs their eye pressure lowered right away, lowered a lot. Certain types of glaucoma, certain subtypes like neovascular glaucoma or uveitic glaucoma, they might do a little bit better with a tube compared to a trabeculectomy because when your body tries to scar up the trabeculectomy, well, the tube has a plastic tube that stays in your eye and it keeps that passageway open. So the benefits are it works, it lowers your pressure a lot, and it's kind of controlled in that the tube's always the same size. Whereas for a trabeculectomy, the surgeon creates the size of the trap door,